Hey everyone, this is the PA, Alex. I wanted to share a story that was really impactful to me when I was on mission in Africa in 2024. This little girl had come to see us on our last day of clinic. She was the last patient. She comes in with her forearm wrapped up in bandages. They explained to us that 1 year ago she had been climbing a tree, she fell, and she broke her radius, the bone in her forearm, and that resulted in an open fracture, which is where the bone breaks and sticking out of the skin. She's got it wrapped up in bandages. It had been that way for 1 full year. There was no emergency room, there was no help, there was no doctor, there was nothing that she could do except cover it up, and I think they did their best to try to keep it disinfected. It is a miracle that that girl didn't have an infection. She wasn't septic, which is when bacteria can get into the wound, into the blood, into the body, and it causes all sorts of problems. Your blood pressure can drop dramatically. When it's advanced, your organs can start shutting down, and the infection is getting out of control. This girl dealt with this on her own somehow, by the grace of God, just by keeping it wrapped up and doing their best to keep it clean. So the parents come to us and they say, "Can you help?" And of course we said, "We're going to try. We're going to do our absolute best to give your little girl the best treatment possible. We're going to see what we can do." This was our last day of clinic. This was the last day that we were in Africa seeing patients. We had run out of many supplies. We probably had maybe 2 pairs of gloves left at that point in time. We did have instruments with us, but obviously once we use them, we have no way to sanitize them. We kind of put them to the side, and it's a wrap after that. We had one sanitized instrument left that's meant for extracting teeth. It was the only thing that we had that was still clean that we could use to attempt a procedure. So myself and Michael Overcash, who was a physician assistant, he was the medical trip leader at the time, we took this little girl into the clinic's office, which we had repurposed into a makeshift operating room. We then prepped for this procedure by liberally applying betadine solution to the wound. For the anesthetic, we applied a liberal amount of lidocaine to the site, and we had the girl's father in the operating room with her to support her throughout this process. It was a very difficult procedure because, as you can imagine, the girl was feeling a lot of distress and a lot of anxiety while we were trying to press on the bone and manipulate it and try to find a weak area in the bone where we could essentially break it and remove the piece that was exposed. As you can imagine, there was a lot of tension in that room. The child was distressed. And the whole time we're just praying, "Jesus, we don't have the best tools for this. We're trying to do our best. Please help us find a way. Jesus, please help us find a way." After some time of manipulating the bone, we finally heard a snap where the brittle section of the bone that was decayed and that was very dry broke off, and we were able to go ahead and close the wound. Praise Jesus. So we applied a clean dressing to the site, and then we provided mom and dad with replacement dressings and more ointment to be applied every time they changed the dressing. And we provided the child with 30 days of antibiotics to prevent the possibility of any kind of post-operative infection, especially because we wouldn't have the opportunity to see the child again, as this was our last day in Africa. And believe it or not, that was our last package of antibiotics. The very, very last one was the one we gave to this child. It was a miraculous thing to experience. It was basically the last of everything. We had exactly what we needed to take care of this child, which was just extraordinary. That case for me definitely was by far the most impactful. It's stories like that that remind me how necessary this work is and how important it was to be able to share the love of God to that little girl. I truly believe that she was forever changed, and I truly believe that she knows that God loves her so much that she sent people from a faraway land to go and meet her at her time of her greatest need. Cases like hers and stories like hers are a great reminder for me of why this work is so important and why I want to continue to do it year after year. Thanks for taking a moment to listen to my story, and hopefully I'll have many more to share.